Another risk factor for cardiovascular disease is chronic obstructive pulmonary disease, or COPD. COPD is a common condition, sometimes called emphysema or chronic bronchitis, and previously also known as chronic obstructive lung disease. According to the World Health Organization, it is the third most common cause of death globally. Worldwide, the most common cause of chronic obstructive pulmonary disease is smoking, but there are other causes, such as environmental factors like air pollution or fuels that are burnt for cooking or heating, radiation, and also frequent childhood infections and malnutrition affecting lung development. But certainly, smoking is the big contributor. It's thought that in a lifetime, about 50% of smokers would meet the definition for chronic obstructive pulmonary disease, though it may be mild and with few symptoms. The key symptom and source of disability, breathlessness, arises from obstruction of the airways caused by loss of the elastic tissues that normally hold these airways open. This loss of tissue has occurred due to years of exposure to noxious substances such as cigarette smoke, which cause oxidation and inflammation. This oxidative stress also makes chronic obstructive pulmonary disease a risk factor for cardiovascular disease by accelerating damage to the blood vessels and causing arteriosclerosis. There is no cure for chronic obstructive pulmonary disease, but smoking cessation is the key to preventing further deterioration in lung function. It is very important to get the message out to young people to quit smoking. When you are young, your lungs are developing. Lungs don't reach full capacity till our 20s. So if you smoke before that time, you don't ever reach full lung capacity. In your 20s, there's a period of about 10 years when your lung function is fairly stable, and then, unfortunately, peak lung function declines sometime from about the 30s onwards. So smoking while you are not yet at your peak makes that plateau shorter, and you never reach your full potential before the lung function decline starts accelerating. Some of the other symptoms of chronic obstructive pulmonary disease, apart from breathlessness, are its effects on sleep. And sleep is a big part of the story with chronic disease. When we go to sleep at night, some of our breathing capacity is suppressed. Some of our muscles that are involved in breathing become inactivated when we sleep. So, if there's already impairment with our breathing from chronic obstructive pulmonary disease, this is further worsened and it can lead to a drop in oxygen levels. If a person has another sleep disorder, like sleep apnea, added to chronic obstructive pulmonary disease, these two together worsen the problems we see at night.
The combination of chronic obstructive pulmonary disease, or COPD as it's known, and sleep apnea is sometimes referred to as the overlap syndrome. The prevalence of this combination is not entirely clear, although recent studies suggest a greater prevalence of OSA among COPD sufferers to that seen in the general population. COPD and OSA are each independent risk factors for cardiovascular events. Hence, it is reasonable to speculate that the coexistence of these two problems in overlap syndrome probably heightens the risk. The mechanisms underlying cardiovascular risk are still unclear. However, they are likely to involve a number of factors, including systemic inflammation, vascular dysfunction, and sustained elevation of sympathetic activity, or the stress response. The main treatment for this overlap syndrome in stable patients is a device called continuous positive airway pressure, and we sometimes add oxygen should it be required.